But we begin tonight right here in Washington, where the road to finishing off President Obama's biggest domestic policy item took a few sharp turns today. Today, the top Democrat in the Senate, Harry Reid, made official something that has long been speculated about. Senator Reid informed his Republican counterpart in the Senate, Mitch McConnell, that Democrats will use reconciliation rules to pass the final fixes to health reform. That means that the process of passing health reform can be finished with 51 votes instead of 60. We've long thought that might happen. Now we know that it will. Everybody freak out. Meanwhile, on the other side of the Capitol, Democrats in the House huddled today to go through the language of the bill that they're going to have to pass in order to get this done. One major headline from the House side today: the Democratic leadership now appears ready to call the bluff of Congressman Bart Stupak and the mysterious unnamed group of Democrats Mr. Stupak says he speaks for, who he says are willing to vote against the entire health reform bill if it is not changed to turn it into a vehicle for drastically restricting access to the legal procedure that is abortion. House leaders have reportedly concluded that they cannot change the abortion language in the bill, and they're now willing to move on with or without Bart Stupak and whoever it is that is really with Bart Stupak. Stepping out of that presumably dramatic caucus meeting today in order to talk to us about what happens next on health reform was the Democratic House Speaker, Nancy Pelosi. Do you have an expectation of when something will be passed the House?
Well, our timetable always starts when the Congressional Budget Office gives us our score. I know that's very inside process, but the policy has to spring from the numbers. We must reduce the deficit. We will by $100 billion at least in the first 10 years, $1 trillion in the second 10 years. And so if there were no other reason to do health care insurance health reform, it's to lower the cost because the current system is unsustainable to individuals, to families, to businesses, to our federal budget and state and local budgets, and also to our economy, which cannot be as competitive as we need to be with this anvil of health care cost around us. Senator Kennedy last year at that summit meeting, he came in, made a grand entrance and said, I've come to sign up as a foot soldier in the battle to get health care for all Americans as a right, not a privilege. So it cost her one thing. This is a value for us. As he said, this is not about the provisions of any bill. It's about the character of our country. So with that inspiration, the president's leadership, the urgency from the cost standpoint, what that means to America's families, we're ready to go with our bill, and that is where our focus, our energy, our time is spent.
And you, of course, have expressed confidence that you will get it passed in the House. Of course, it was a narrow passage, just a couple votes to spare the last time around.
May I just say, sure. Every bill is a heavy lift. Yeah. There is not one easy bill.
Let me ask you about
one. Every bill is a heavy lift, and so the issue is when you have the votes, you take the vote and you win, and but never expect it to be easy.
Well, let me ask you about one member of your caucus who is trying to make it heavier. is Congressman Stupak from Michigan, is somebody who we've talked about a lot on my program. When he says that the Senate bill, as currently written, spends federal money on abortion, is he telling the truth?
Well, let me say that I have the highest regard for Congressman Stupak. He's a valued member of the Congress and of the Energy and Commerce Committee on which he serves. The facts are these. First of all, there is no federal funding of abortion in the legislation. It is the law of the land that we are prohibited from spending federal funds on abortion, and that is consistent in this bill. There are, one, no federal funding of abortion in the legislation. Secondly, that if you agree that that's important, and secondly, that it's important not to have any increase or diminishment of the right to choose. It's neutral in that respect. No federal funding, no change in the woman's right to choose more or less. And third, that you want to pass a health care bill, then we have the opportunity for you to do that. There's no federal funding in abortion.
So he's wrong when he says that there is.
Well, yes, but let me say this. If he wants to read certain things into it, then you could say there's federal funding in abortion if there's a tax deduction for a woman to have a health insurance plan that allows for reproductive health services in it. So in any event, no federal funding, no change in status of a woman's right to choose. You want to pass health care reform, you can do it here.
One of the ways that Congressman Stupak has made such a splash with this allegation, which again you say is not based in fact, that his allegation that there is federal funding for abortion in the Senate language, one of the ways that he's made a splash is by saying that he speaks for a dozen members of Congress who will not vote for health reform unless his language is added to the bill. Have those supposed dozen members come and address those issues with you or with their office? Have you dealt directly with Congressman Stupak?
Let me say this, and with all due respect to your question, sure. Rachel, this bill is not about abortion. This is about health care for all Americans. And those who want the bill to fail hijack the good intentions of others who have concerns about federal funding of abortion and should turn it into a conversation about that. But the more we talk about that, the less we talk about innovation and prevention and wellness, about affordability for America's middle-income families, about access for those who have not been able to access health care before, about holding the insurance companies accountable, ending any denial of access to health care because of a pre-existing condition, capping the premiums but not capping the benefits either annually or on a lifetime basis, about what it does for children and young people to stay on their parents' policy until they're 26 years old, what it does for seniors in terms of closing the donut hole. If you're not a senior, which you are not, but which I am, you know what closing the donut hole means, but it makes purchasing of pharmaceutical drugs, prescription drugs, more affordable for them. And if you are a woman, women have so much to gain from this bill. Right up until now, being a woman is a pre-existing medical condition. If you're a woman, if you're childbearing age and you have children, it's a pre-existing condition. If you can't have children, it's a pre-existing condition. If you have a C-section, it's a pre-existing condition. If you're a victim of domestic abuse, it's a pre-existing condition. So you can't, everybody has so much to gain from this. Small businesses, as I say, seniors, young people, women, our economy. Think of an economy where people could be an artist or a photographer, a writer, without worrying about keeping their day job in order to have health insurance, or that people could start a business and be entrepreneurial and take risk, but not be job locked because a child has asthma or diabetes or someone in the family is bipolar, you name it, any condition is job locking. Think of a situation where we can be internationally competitive because we don't have this weight on us that other businesses really don't have in other countries because they don't have this expense of health care, which will all be reined in, those costs, under this bill. We cannot afford the status quo. We will make this difference, and it will make a wonderful difference in the lives of our people, but also in the vitality of our economy. That's what we want people to talk about, not about,
And that's the pro-healthcare reform stance. One of the best, put as well as I think I've heard anybody put it. And the concern for people who want what you just described is that there are people trying to hijack it. And so the prospects for actually getting health reform done in many ways are in the House now. With Senator Reid today saying that it is going to be reconciliation in the Senate. That means there is a 50-vote threshold in the Senate for being able to pass fixes to the bill.
That's a great statement. I'm very thrilled to hear that. Yeah.
Which is, and it's important, and it says a lot about the likelihood of passage in the Senate for this moving forward. All eyes on the House in terms of getting this done. You have expressed confidence. I have focused a lot on Bart Stupak as a person who's trying to hijack the process to make it an abortion debate and not a health care debate.
Sorry. Excuse me. Bart Stupak wants health care reform. This is something he understands. He's on the committee of jurisdiction for it. I don't think that he's that he himself would be one to say I'm taking down health care reform because of it. I think but I think others who are part of that, who have stronger connections to the Republican Party, do want to bring down the bill. And
Republicans want to bring down the bill, or other Democrats?
Well, no, Republicans. No, the Democrats want a bill. I don't think there's any question in our caucus about our commitment to that. But I cannot let the good intentions of some on a subject that is very important to them be hijacked by those who do not want health care reform.
I cannot let the good intentions of some on a subject that is very important to them be hijacked by those who do not want health care reform. In other words, Nancy Pelosi telling me today that she will not let Bart Stupak's heartfelt, if misguided, anti-abortion intentions be hijacked by Republicans who want to use him to kill health reform. In fact, it is now clear that Mr. Stupak is not going to be able to kill health reform. His shot at doing so by turning the health debate into an abortion debate ended today. It appears to be done. Speaker Pelosi telling me today, and Congressman